My name is Dan Favre. I'm the Executive Director of Bike Easy, and I'm excited to take the next 20 minutes or so to do a brief overview of the Complete Streets for Health Equity and Evaluation of New Orleans and Jefferson Parish report that we put together with the National Complete Streets Coalition, which is a project of Smart Growth America, as well as the American Heart Association Voices for Healthy Kids program. I want to thank as well all of the Jefferson Parish and New Orleans Complete Streets Coalition members, many of whom are in the room here today, who've helped put this report together and craft our work to build streets to share. And thanks especially as well to the Bike Easy staff, board, Complete Streets ambassadors. It's so great to see everyone here together. At Bike Easy, we believe in the power of bicycling to help create a healthy, resilient, and equitable future for all the people of Greater New Orleans. And we know that streets that are safe for bicycling are also safe for walking, safe for taking transit, and safe for driving. As individuals and organizations and governments who work to tackle the critical issues that we're facing here in the region, poor health outcomes and inequity, economic development and job access, crime and public safety, affordable housing, flooding, and the impacts of climate change, like what Andy was talking about, it's becoming clear more and more that how people move around or how they struggle to move around affects so many aspects of life and decision making. Oops, sorry, jumping ahead there. For us, really, safe, convenient transportation options for everyone in Greater New Orleans are essential to our vision of an equitable, vibrant future. People of all ages and abilities need to be able to bike, walk, and take transit no matter how much they earn or where they live. Streets built to share that prioritize health equity offer a path towards realizing that vision, and so we're really excited to present this detailed Complete Streets for Health Equity framework in this report today. Before I dive into the report though, I did want to take a moment to recognize a really momentous occasion that happened yesterday. If folks didn't know, but the Blue Bikes New Orleans program has launched. Bike Easy has advocated for many, many years to bring bike share to the city of New Orleans, and we're thrilled to see this easy, affordable, and accessible public transportation option available to the people of New Orleans. And it really speaks to just how much we're on a roll here in Greater New Orleans when it comes to walking and biking, whether it's the new newish Lafitte Greenway, or the longtime assets of the levee trails in Jefferson Parish, the work of the Pedestrian Bicycle Safety Advisory Committee and City Council, or the Jefferson Parish Bicycle Master Plan. There's just so many great things happening, a lot of momentum, and we're really looking to continue building that momentum. Of course, there is a long way to go. One of the most striking statistics that we found in our report is that in New Orleans and Jefferson Parish, 36% of people live in high poverty census tracts, yet over 67% of crashes involving people walking or biking occur in these places. Let that sink in for a second. Where about a third of our most vulnerable population lives is where you have double the chance of being hit by a car when biking or walking. So we really believe that complete streets must be a priority for creating a region that truly provides for health, prosperity, and quality of life that all the people of Greater New Orleans deserve. And by evaluating complete streets through a health equity lens, we hope to bring health equity to the forefront of the conversation on transportation and highlight the importance of providing equitable access to all resources and opportunities, regardless of age, ability, race, income, or mode of transportation. And thus, it's in that spirit that we present this report, to show just how far we've come, where the best opportunities lie ahead for New Orleans and Jefferson Parish, and how each jurisdiction can measure success as we create complete streets for health equity. So, first of all, what are complete streets? Folks know? Raise your hand if you think you know what complete streets are. All right, that's pretty good. I think it's a question best answered by a visual. And so, well, complete streets are streets that are built to share, that are safe and accessible to all people, whether biking, walking, pushing a stroller, riding in a wheelchair, waiting at the bus, taking the bus, and driving. What that looks like are protected bikeways, ADA accessible curb ramps, bus shelters where you can be out of the rain or sun when you're waiting for your ride, high visibility crosswalks and pedestrian signals, and really when it all comes together where you have all people that are using the roadways doing so safely and easily. Complete Streets is also a policy approach. In order to get the outcomes like what we just saw in those photos, we need to have the right policy in place. And actually the National Complete Streets Coalition, who are the real primary authors on this report, also just released an updated 10 criteria for ideal complete streets policy. We don't have time to go into all the details on that now, but we really focused in on number 8, which is performance measures. And that's because if we want to measure success, or we want to be successful in implementing any program, we have to know how we're measuring that success. So we chose to approach Complete Streets through a health equity lens based on the data. In our analysis, in both Jefferson Parish and New Orleans, black households are twice as likely to not have access to a motor vehicle. In Louisiana, education levels and income have a huge impact on an individual's likelihood of experiencing asthma, disease, hypertension, or heart attack. And this really comes about from decades of discriminatory housing and transportation policy that has had a disproportionate impact on low-income communities and communities of color. We chose to focus on evaluation and performance measures because evaluation is crucial to success of any program, like I mentioned. Specifically, that means we can demonstrate progress, we can identify gaps and figure out priorities of where we need to make investments, and crucially, we can hold programs accountable to the goals that we set out. Right now, when we think about how we're doing on Complete Streets, especially in New Orleans, there's a lot of great pieces that we use. The number of miles of bike lanes that are out there, the increased ridership, we also look at safety and the impacts. But we really need to put that into an overarching framework. And in order to understand how actions now impact long-term trends like health outcomes, we need the right evaluation framework. And so that's what we're here to propose today. When we apply a health equity lens, we can understand how the right inputs lead to the right outputs, which lead to the right short-term outcomes and the right long-term outcomes. And to do that, we really need to dig into the data. This chart might be hard to read up here. You all should have it in your report brief as well. I'm not going to go too deep into the data collection and crunching. It's really, a lot of the details are in the full report. We do have some copies of the full 35-page report here. You can find it on our website. But we could always use more data to have a clearer picture. But there is a lot that we can learn from what's already out there. And so we put together this evaluation framework to ensure that we are actually tracking progress and in these performance measures that make Complete Streets lead to health equity. And I'm going to take you through some highlights from our evaluation in order to really illuminate these pieces and also give some of the recommendations that we've come up with. So changes to transportation planning processes include updating planning and design documents, training staff, and engaging the public. The data is particularly light in this category, but there has been varied amounts of progress over the years. And the one place that I really want to focus on, especially from an equity perspective, is meaningful community engagement. It's just a crucial component to creating the long-term health impacts that we want to see, and there's certainly room for improvement there. Decision makers need to focus on creative ways of communicating with people who've long been left out of the decision-making process. And that means tracking who you're hearing from. How many people of color? How many people from low-income communities? How are we reaching people who won't come out to a boring public meeting or even a lunch briefing like this? And it takes a lot of effort, but it really does pay off down the road. And one example of this type of creative community engagement, something that Bike Easy worked with the City of New Orleans on to do a pop-up bikeway, a demonstration pop-up on St. Bernard Avenue, where for 6 blocks we actually built a protected bikeway, a parking protected bikeway, which at that point didn't actually exist anywhere in New Orleans, and got the community to come out, experience it, help put it together, do surveys, give feedback, and it was a really great way to build momentum towards Complete Streets for health equity. New Complete Streets projects and investments. So this is the funding, the quantity and quality of Complete Streets projects, the number of and explanations for exemptions, and crucially, as Andy was talking about, green infrastructure is an important piece to incorporate here in Greater New Orleans. So in Jefferson Parish, there was recently a bond measure passed that had over $55 million for projects that support biking and walking, and we were really pleased to see that almost half of those funds will be focused in low-income zip codes. In New Orleans, since the Complete Streets Ordinance was passed in 2011, we've just seen a huge, continued rise in the mileage of bikeways, whether you measure that as the lane mileage or the center lane mileage. So that's really exciting and great momentum. One thing that we've also noticed in New Orleans is an improvement in the quality of bikeways since the Complete Streets Ordinance was passed. You'll note I'm focusing on bike stuff a lot. Not just because we're Bike Easy, but because that's actually where the most data is that we could use. But this point about the quality of infrastructure is huge, and we need to keep improving the quality of infrastructure to make sure that the experiences of people walking and biking and taking transit are truly low stress. not all bikeways are created equal, right? When you're going over the St. Claude Avenue Bridge, yeah, there's some sharrows and some signs, but it's still a terrifying experience. Whereas when you're over on Old Berman Highway on the West Bank, and there's a two-way protected bikeway that's got physical delineators between the motor vehicle traffic and yourself biking along, it feels really good. So we want to move towards protected bikeways, sidewalks that actually work. We can count the miles of sidewalks, but when they're the biggest mountains in New Orleans are sidewalks, that doesn't really work. So quality of infrastructure matters. Where the infrastructure goes also matters a lot. So this map maps the bike lane network with census tract poverty data, and we can see that there are still high poverty areas that are left out of the network and a lot of missing connection points. So we need to make sure that we are actually building a network, and we've come a long way since the Complete Streets Ordinance was passed. The light green lanes are since 2011, the dark green were before that. And you can see we really are building out a network, and we need to keep going. We need to build that network of low stress bikeways. We also need to have that integrate with networks for walking and for transit. New connections and opportunities. When we're getting the new Complete Streets projects and investments right, we get new connections and opportunities. This means travel behavior, mode share as people call it, how many people are biking and walking. Safety, affordability, especially looking at housing and transportation costs in tandem, and access to resources like healthcare, grocery stores, your job. So we really have seen a continued rise in the number of people biking to work in New Orleans since the Complete Streets Ordinance passed. And with the counts that are done by the University of New Orleans Transportation Institute and the Regional Planning Commission, there's been a marked rise in the number of people of color who are riding bicycles. One really interesting thing to note since the Complete Streets Ordinance has passed is that there's been a relative increase in safety for bicycling, but a relative decrease in safety for walking. So we really looked at this by showing, all right, what are the numbers of people walking, and then what are the numbers of the crashes involving people walking? So the reason that the risk has gone up for people walking is largely because the numbers of people walking have gone down. This is according to American Community Survey data. Well, we know also the number of people biking has gone up, and you might be reading more about crashes in the news, but relatively the number of people biking is outpacing the number of crashes. So there's the risk of being injured while biking has decreased almost 30% since 2011, up until 2015, or 2009 to 2015, excuse me. But the impacts are still very disproportionate. As I mentioned before, in the areas where our most vulnerable populations live, there is a disproportionate number of bike crashes and walking crashes. One important piece of new connections and opportunities is actually making sure that the networks of biking and walking and transit serve people to get to their destinations. So this is access to employment centers. You can also look at grocery stores and healthcare, and it's pretty easy to point out the parts of New Orleans that are lacking that connection to the employment center. Holly Grove, the Desire area into the lower 9, New Orleans East, and some on the West Bank. Well, when we start getting those new opportunities and connections working properly, that's where we see changes to long-term health trends. And we have seen some reason to be hopeful over the last 5 to 7 years, where in New Orleans, the metropolitan region, the percentage of people who are getting enough physical activity has actually risen by 11.6%. And we also have seen hypertension rates decrease slowly. So this is what we want to make sure we're continuing to see these long-term health trends. And we're going to make sure that we have the input, the community engagement that leads to the new Complete Streets projects and investments, that leads to new opportunities and connections, and then we get long-term health trends at the end of it all. So some specific recommendations here in the city of New Orleans, which has a Complete Streets Ordinance on the book. We suggest adopting Complete Streets performance measures. We are offering a few of them here in this report today, that prioritize health equity and publicly report the progress on those measures regularly. We need to ensure meaningful community engagement and transparency at all levels of decision making, and create a framework to prioritize high quality Complete Streets connections, the places they're needed most. This is really thinking about that idea of the network and quality of infrastructure. In Jefferson Parish, we need to institute a comprehensive Complete Streets program, really based on the National Complete Streets Coalition's 10 criteria. We want to expand the bicycle network to high poverty residential areas, work to embed complete streets in routine decisions, and encourage more staff trainings. And finally, while crashes in Jefferson Parish have been pretty even over the last number of years, as we start to see more investment in biking and walking, we want to proactively intervene to protect vulnerable users from traffic crashes. And then throughout the region, We suggest collaborating with local and regional health organizations. When we talk about data collection, that's not something that the parish and city can necessarily do all on their own. We need to incorporate data that's coming from other sources. We need to conduct qualitative interviews about the barriers to physical activity and wellness. One really important piece is continuing to develop and refine an approach to evaluate successes in stormwater management. So many of the things that Andy listed off, we can actually do that in our streets as well, and we need to really define those metrics. And then finally, we need to take a regional approach and collaborate across city and parish lines. So that about wraps it up. I'm super excited for this report and the detailed information that's in there, and I'm really looking forward to working with the City of New Orleans, Jefferson Parish, our coalition members, all of you here in the room today to build complete streets for health equity and help really move us down the path, down the road towards a healthy, prosperous, and equitable future for everyone in Greater New Orleans. So thank you again, and we might have some time for questions. Yeah, cool. So I think we have time for a few questions if anybody's got anything they want to ask me. Oh, yeah, sure. Great if no one does. There's lots of other awesome speakers that you can ask questions of as well. Well, if you do think of anything, if there are any questions that come up, this is my contact information. I've also put up the contact information of Heather Zaccaro, who works with the National Complete Streets Coalition, as she was really did most of the data analysis. So as you're reading through the report and you want to dig into the technical side, please feel free to reach out to her. And it looks like we have a question.
Is there any interest in using the neutral grounds for bikeways?
There is some interest. There's some difficulties in figuring out when you have to cross the cross streets in the neutral grounds, but it does seem like that's an area where there's a lot of space that we could use them. And on Jeff Davis, there's a nice bikeway in the neutral ground. There's a couple other places, and I do think there are some spots where there is interest and people are looking into how best to do that. So that might be a better question for some of the folks that are going to be up on the government panel. Thank you. Anyone else? All right, well, thanks again for your time here. And now I'd like to invite all the members of the community panel to come up, which is going to be moderated by Coretta Lagarde from the American Heart Association.